Knock knock. I'm Ryan Cavillage. I'm your Rhode State nursing student today, and I will be inserting a Foley catheter. Close for privacy. Wash my hands. Then I would match my tar with my physician's order to my patient. My patient is Yankee Candle 3189. No known allergies. Not allergic to tape or latex. Today we are inserting a Foley catheter. Yankee Candle 3189, no known allergies. We are inserting a Foley catheter. Then I would ask my patient what his or her name is, and then match it with my tar. And then I would also look at their name band, which is Yankee Candle 3189, no known allergies, not allergic to tape or latex. Then I would set this down. And I would ask my patient if they needed any pericare, and if they needed pericare, I would perform it. And at this point, they do not need any pericare. So I would raise the bed and put my patient in dorsal recumbent position, and then I would take the blanket down and place this for privacy of the patient. Okay. Then I would make sure I position a light. Then I would start opening my stuff. Clear my workspace. Open my bag. I would use this as my hazardous bag. I would open this out the furthest way. Make sure I do not contaminate. Okay, then I would take my gloves out. Would grab this. I would go across the 1-inch border. Do not contaminate. I do not need this. I'm going to put on my sterile gloves now. Okay, I would put on my non-dominant hand first. Then I would put my dominant hand, and it's sterile to sterile. And then I could reposition this. Going to take off this, put this down back in there, and I would unhook my water and my lube, and then I grab my water and connect it, my solution, and connect it. And then would make sure it does not fall. Okay, then I would lube this 1 to 2 inches. And place this back in the box. Now I open my alcohol swabs. And place this in my box. Now I'm going to use T-Rex hands. T-Rex arms. Place that here. Okay, with my non-dominant hand, I'm going to open the labia and I'm going to identify the meatus. I'm going to wipe the outer side first, and then I'm going to come around, do not contaminate. Then I'm going to out the inner side, come around, do not contaminate. The inner side, the middle, do not contaminate. And then I would insert this about 2 inches until I see urine. And then once I see urine, another 2 inches. Then I would hold it with my hand, and then I'd slowly inflate the balloon. Then I would tug on it till I feel resistance. Then I would unhook the water, and at this point I am no longer sterile. So this goes in my sharps container. I would clean up my mess. Take off my gloves. Right, clean up my mess. Take off my gloves. Put them there. Wash my hands. Attach this to my patient's leg. And make sure that the bag is downwards so the urine is not going back up to my patient. Okay, this would be connected to their leg. And then I would empty the drainage. I'd lower the bed back down to regular position. I'd cover up my patient, make sure they're comfortable. I'd cover up my patient with their blanket, make sure they're comfortable. And that is it. I would wash my hands and document my 7th rite.